Yeah.
Yeah. All right. And so the other thing I wanted to mention was about, like an anti-inflammatory nutrition lifestyle. Is just kind of taking away foods that are pro-inflammatory and how that would help if you have tension type headaches. There is a neurovascular inflammation going on when patients with tension headaches, their IL-1 beta levels are high. So that correlates with neurovascular inflammation. So for sure, if you have foods that are pro-inflammatory in your diet, like processed foods and sugars, diet high in sugars and refined carbohydrates, um, simple sugars, is going to be making your tension headaches worse. It also makes your mental health a lot worse. So just kind of refraining from those type of processed foods goes a long way in managing that. Um, so just like an anti-inflammatory lifestyle, along with your dosha specific changes that you have been recommended to do, that would really help a lot. Do you have any comments about that? Have you noticed any patterns there?
Yeah, absolutely. One of the recent articles in
Mm-hmm.
PubMed actually mentions that undigested food
Mm-hmm.
actually forms one of the fundamental building blocks for neuroinflammatory diseases.
Wow.
So that's where we come from Ayurveda. We're saying you are really not just what you eat, but what you burn or what you process or what you digest. Um,
Sure. Sure.
because especially for vata abnormalities, imagine vata is fire, right? Sorry,
Yeah.
vata is wind, right? So the wind,
Wind.
if
Yeah.
it's blowing super high, that actually makes the fire really inconsistent. So that's why I don't know whether you've noticed, but you may have patients with vata types of headaches have very inconsistent appetites.
Pattern.
Yeah, irregular appetite. I feel really hungry, or I feel no, I'm not hungry at all. There won't be a
Right. Right.
consistency in the appetite, and so that
That's right.
comes from again. That's where you need to focus on those um, the six tastes. So you've mentioned that the processed sugars are to be avoided. Um, More important, alongside the same lines, is that trying to go to nature,
Right. Right.
even if it is sweet,
Even if it's sweet taste. Yeah.
the taste is different from the fact that the sweetness comes from certain characteristics of certain foods, not necessarily whether it has calories or not.
Sure.
Um, that's a different ball game when you start counting calories. But the nature of the foods that you choose has to be consistent with your own phenotype. And the best strategy would be trying to balance all the six tastes.
All 6 days ideally in one meal, and you're eating real foods. You're not eating fake foods, right?
Yeah,
You're
yeah.
not
Anything in
drinking a
the
diet soda, right? Yeah.
Yeah, well, anything in the shelf that is,
Right.
manufactured and sitting in the shelf for a long time has no prana, because
Right.
prana is one of the first things that we learn in Ayurveda is energy. Because
Right.
I have patients filling up questionnaires in my clinic saying low energy, they mark a 5 on that, and that's because you're energetic only when you get energy from the food, and the food has to have energy. So that's why they call it farm to table these days, farm to table foods. And also on that same lines, you are getting energy not because you ate the food, but only because you actually were able to process and metabolize the food to extract the energy from it.
Really well. So yeah, the more pranic force, the more chi it has. In Chinese medicine, they talk about the same thing. The chi or the life force in the food. The more fresh it is, the closer to natural form it is. So like sprouted foods
Mhm.
would go a long way. Like um, there's in Ayurveda, I think there's good recommendations on like sprouting, right? Sprouting the I think it's the green grams, sprouting those.
Absolutely.
Um, right, right. Those have a lot of
So the
pranic.
one of the daily routines
Mhm.
that we follow in Ayurveda, they go a long way in preventing not just vata based issues, but also it creates a perfect environment in which you can sustain these health maintenance over a longer periods of time. because in Western medicine, we definitely need Western medicine uh,
Definitely.
to quick fix, so that you are even in a decent amount of mental state, so that you can actually do these things.
Do these self-care things, correct?
Yeah.
Yes,
So
because these things take a long time, and Western medicine is very good at helping where your balance is sort of broken down and it's coming to your rescue at the time. But long term, we want these so we don't have medication overuse headache, and we don't have, side effects from taking all these abortive treatments and preventative treatments. So that, yeah, I think that really goes a long way. What's your opinion about daily self-care? We mentioned breathing exercises, setting, regular sleep wake timings and nutrition. Anything else people can do, like maybe massages or trigger points? What do you suggest?
yeah, massage is definitely underutilized.
Hmm.
Even I mean, I'm I'm no perfectionist in all of these. I'm learning just like everybody is,
Right,
and
right,
not just because I'm a physician, that doesn't mean that I don't have symptoms or I don't have health problems. I'm
right,
a
right.
patient here talking to you all. So yes, definitely. Based on your phenotype and based on the time of the year, um, certain oils are meant to be for that uh, type of people and type of weather. So sesame oil, for instance, is warming, so very good for the winter times. And we have lotions available these days that moisturizer and all that. But I prefer natural oils, because let me tell you one thing: we use topical lidocaine or topical medications because we know it gets absorbed into the system and actually
Sure,
goes all over our body to establish its impact. And therefore,
sure.
anything that you put on your skin,
Hmm.
all I have been taught to think about is, would you put that in your mouth? Because
That's a
it's
good point.
literally
Yeah,
going into your
literally, skin is the biggest organ, right?
yeah, it's
Right.
going into the enterohepatic circulation
Right,
and gets processed in the liver. So the liver has to metabolize all of
right,
the
right.
things that are in the lotion. So that's why I prefer putting things on my skin only if I would put that into my mouth also. And
That's
yes,
a
I
really good
do,
point. Yeah.
do consume sesame oil. It's natural, and or any oil, almond oil, um, all these walnut oils. These are all very useful. Slightly warm it up, and just before oil massaging, they say that it's a very good idea to dry brush, which is also called as
Oh, yes.
exfoli-
Lymphatic. Lymph-
yeah, exfoliation. So, and
yes.
then you can apply the oil massage so that it gets absorbed very nicely. And when you mention lymphatic, yeah, lymphatic massage, because the
Right,
lymph vessels don't have any pump or valves, so that
right, right.
we have to be the ones that literally force up the lymphatics.
That's wonderful. So you're dry brushing towards the direction of the lymph flow, which is towards the heart, right? Towards the heart in both ways. And so that'd be good before you do the oil massage and
Really for the head also, since you're talking about headaches,
right, right, right,
local head massages,
right,
you can basically massage and then take a shower after 10 to 15 minutes. Similarly, applying the warming oils underneath the sole of the foot is very helpful at night time before you go to sleep. And then for vata people, nasya is amazing. Nasya is basically nasal sprays that we use, like Flonase,
mm-hmm.
allergic rhinitis.
Right, right,
We have either ghee, which is clarified butter, which is very grounding and warming, and the same sesame oil or peppermint oil. These are all very nice to just apply a little bit outside the nose, so that that goes straight into the olfactory bulb and direct connection into the central nervous system receptors, and leads to calming of the receptor stimulation. And usually tension headaches, it comes like this, as well as goes down back into the
goes
mouth.
down the back of the right, right,
So local massages, and then relaxation techniques,
right, right.
shoulders, stretching is super important. I have a video on my YouTube for stretching. I learned from KYG Yoga, Sundar Iyer, and a very simple 10-minute, because we have to hurry to office in the morning. So very efficient ways of getting the stretch for the day is very useful for that.
Right, right. So like gentle traction, stretching your neck, I think in certain poses where you feel it down, this trapezius muscle, which is an area of a lot of tension, that area of whole muscle tension, which is there. And classically, it used to be one of the diagnostic criterion for tension headaches. It is no more, but still noted in patients with tension headaches. So I think, yeah, that really would help. And it's a simple thing that people can do at home by themselves. They don't necessarily have to go to Massage NB to do a small, um, trigger point release for them, like the base of the head, finding that kind of midline and these areas in your trapezius muscle. So, and the dry brushing, if you have the brush with a long, I think the long handle, I think that would help too, because you can't really reach some of those areas. And then acupressure, there's a lot of interest in acupressure too for tension headaches. And in Chinese medicine, they talk about like actually giving pressure right here in the center of the head. I'm sure there's something similar in Ayurveda, given that's one of your chakras, right? So,
Yeah.
do you have any?
Yeah, Sahasrara chakra is there, and
Yeah. Mhm.
we call it also marma therapy or marma point.
Uh-huh.
And
Uh-huh.
in fact, I just signed up for a course,
Uh-huh.
learn about marma points. So I
Right,
don't have
right.
any expertise, or I don't have any learning experience so far in which
Sure, sure.
exact positions to touch. But consulting a Ayurvedic, a
Sure, sure.
certified NAMA National Ayurvedic Medical Association practitioner would definitely help.
Help with that, yeah, with those acupressure points. And there's another one between your thumb and your index finger, that's another acupressure point for people with tension headaches. So all these kind of other harmless strategies to kind of keep working on self-care, that would go a long way. I think we covered most of the self-care items. Do you have anything to say about any kind of herbal supplements that a
Sure.
Vata type person should take?
Yeah, as I mentioned, 90% or 95% of benefit
Mhm.
from Ayurveda actually comes from the lifestyle
It's the
routine
lifestyle changes.
changes and understanding who you are, what your body type is, why the symptoms are coming, rather than
Right.
being a victim to a doctor like me and coming back and forth, just depending on the doctors for symptom cure. I would rather empower you to become your own doctor, so that you have the power to control your symptoms, control your triggers, and change what you're doing. Herbal supplements, I myself do not go too much into herbal supplements into this, because it's there is a lot of pros and cons. Number one is we have to understand what are the ways they are being made. Is it locally available? Is it from India? And who is processing it? And in general, we always have a tendency to do more and more because more is good. So very minute quantities is what usually Ayurvedic professionals also entertain. So in general, you may have heard of ashwagandha as a
Right.
root that is becoming very famous these days, very calming in nature, because vata tension headaches are usually of the phenotype of excited, too many things going on. So
Right.
just
Right.
resting the mind is helpful, and adding ashwagandha in the form of either this a simpler way is actually there is ashwagandha roll-ons or creams.
Oh, wow.
Even if you don't want to take in, you can apply that, or even just here, you can just apply a little bit of ashwagandha oil or this thing. That's good enough. Triphala in general is known to be balancing for all three different types of doshas, which is VP and K. And the simplest elixir would be warm water.
That's wonderful. Yeah, that's wonderful. I think those are all like really good tips, and I hope it's helpful for our patients. So thank you very much, Dr. Muthu. Thank you very much.
Absolutely. Yes. So I'm hoping we can do this more often, again and
Yes,
again,
yes,
and
we'll do a
hopefully we
series.
even have live, interviews with patients, people who can sign in, uh,
Right, right,
so that we can take more patient questions.
right. If you have more questions, we
And
can.
maybe, because we all have these symptoms depending on what social situations we go
That's
through,
true. That
and
is true.
so we can all,
And we're all learning, so we're all in this together.
yeah, Absolutely. Wonderful.
Thank you so much.
Yes. I'll talk to you soon.